been an additional death, a woman in her 70s who was part of a small number of cases diagnosed in late July. She was then cleared as being coronavirus free and having recovered in late September, but the coroner will look at this, but our advice is that she's passed away very recently, and they believe that coronavirus-induced damage to her lungs has caused her to pass away, and therefore she is counted as a coronavirus death. We of course send our best wishes and our sincere condolences to her family. This will be a very difficult time, and hopefully they take some small comfort from knowing that they are in our thoughts and prayers. Total number of test results that have been received since the beginning of the pandemic is 3,574,270, which is 5,030 test results since yesterday. So pleasingly, we have no active cases. That's now a very significant run of days. We want to thank each and every Victorian who's playing their part, and if I can just leave on the virus as an active challenge for us, if I can leave all those who are watching and listening with just one message. If you've got any symptoms whatsoever, please go and get tested, and please don't delay. Please get tested as soon as you possibly can. That protects you, your family, and every single family. It is the most important thing to do. Secondly, I want to confirm for you that we will make some machinery of government changes from the 1st of February. They reflect the fact that a more focused health department, including mental health and aged care, is appropriate as we both deliver a massive reform agenda, but also come out of this pandemic. It's ongoing management and of course trying to catch up in some areas where the pandemic has made the delivery of health services very challenging. It makes sense to have a separate Department of Health which will include health, mental health and ageing. I can, of course, as you know, Professor Ewan Wallace is the Secretary of the current combined department. He will continue to serve as the Secretary of the Health Department, and Minister Foley will continue to be the coordinating minister. A new Department of Families, Fairness and Housing will be established from February 1. That will include child protection, disability, housing, Family Safety Victoria, all existing DHHS portfolio areas, and added to that will be current functions that are a feature of the Fairness Division of the Department of Premier and Cabinet. They will all move across to the new Department of Families, Fairness and Housing. That's Equality, Multicultural Affairs, Women, Youth and Veterans. Aboriginal Affairs and Treaty will remain part of the Department of Premier and Cabinet. That is fitting, I think, given the very important and high priority that progressing the work of the First Peoples Assembly and the delivery of a treaty is. The centre is the best place for that to stay. The coordinating minister for the new Department of Families, Fairness and Housing will be Minister Wynne. So Richard Wynne will be the coordinating minister, and Sandy Pitcher, who many of you will perhaps know as a bureaucrat of many years' service out of South Australia, the Commonwealth, and most recently as a Deputy Secretary in the Higher Education and Skills Division of the Department of Education and Training, and even more recently having been central to our coronavirus response over at the Department of Health and Human Services. Sandy, she is an outstanding choice. I think she's exactly the right person to head up this new department, as is of course Richard, to be the coordinating minister, given how big our reform agenda in housing is and each of those other areas that I've just listed. That's all effective from February 1. There's no change to total numbers of people employed. These are whole units, so there's no splitting of any particular division in any existing department. And we will do everything we can to keep the cost of these machinery of government changes to an absolute minimum, and they'll be up and running by February 1. Thirdly, I'm joined today by Emma Cassar, who you know is the Corrections Commissioner and who's been running hotel quarantine since the reset. Obviously Minister Neville is here, and so is Deputy Commissioner Ross Gunther. We know that there are many lessons that have to be learned in relation to hotel quarantine, and we have learnt those lessons both from Victoria's experience, but also experiences in Adelaide, experiences in Sydney. Breaches out of hotel quarantine are not unique to Victoria. What we have to be, though, is focused on the best system, the strongest system, to keep Victorians safe and to protect this precious thing that we've all built. Flights, of course, resume on the 7th, 160 returning permanent residents or Australian citizens from the 7th. We have been doing a power of work over recent weeks and months, some of which you're well and truly aware of. This new program will be reset under a specific and dedicated administrative office, COVID-19 Quarantine Victoria. Emma will be the commissioner of that specific single-purpose vehicle, one administrative entity that has no other responsibility than hotel quarantine. She will be supported with a new structure where there will be a Deputy Chief Health Officer appointed for no other purpose than the public health response, infection prevention and control within COVID-19 Quarantine Victoria. Victoria Police will be in charge of all of those security functions, and that's why Deputy Commissioner Gunther is here. He will be in charge of that and will be one of 3 people who work with Emma very closely. The 3rd person that works with Emma will announce that appointment quite soon. That's someone who will have principal responsibility for logistics and planning, some of those very practical things. This is a unique structure. It's exactly what's needed. It is what the Board of Inquiry's initial report put to us, and there's many details that I'm going to ask Lisa to speak to in a moment, and then Emma and Ross can add to that. But this will be done as safely as possible. But we all have to acknowledge that there's no quarantine system that can be built with zero risk. There will always be some residual risk. Some would say that it is inevitable that there will be outbreaks, there will be cases. The key point here is to make sure you've got the strongest system in place to lock down any outbreak, to shut that down without having to shut down suburbs or metropolitan Melbourne or the entire state. And we're very confident that we'll be able to do that because of the planning, because of the learnings, and because of the experience, not just here in Victoria, but in other capital cities across our nation. The other point that I want to make is that part of this now reset and fresh program, the Minister for Police and Emergency Services, Minister Neville, will be in charge of this agency and this program from start to finish. We believe that is an appropriate thing to do now that flights are returning from the 7th. There will also be ADF support in this model. The exact details of that is being worked through with the Commonwealth Government. My office has been speaking with the Prime Minister's office. Our emergency management framework has been speaking to ADF, and we're very confident that we'll have around 200, perhaps a few more ADF personnel assisting us in this reset 160 return travellers per day hotel quarantine system. We've also today released our response to each of the recommendations made by the Board of Inquiry. As you would appreciate, we've had this conversation, I think, a little bit last week. Some of those recommendations have already been given effect to. Others we are absolutely supportive of. We just need to work through how it is we will do that. And then there are some recommendations that we cannot implement at this time, but we'll look at those very closely. And the principal reason for that is that this is not a novel, one-out Victoria doing its own thing. It has to be part of a National Cabinet framework, and we have to have all First Ministers across the country satisfied that our arrangements are consistent with theirs. Otherwise, of course, we do run the risk that borders would be closed again. Some of the freedom of movement that we're just about to enjoy or have very recently started to enjoy with New South Wales, Queensland, and of course Tasmania to come, we wouldn't want to put any of that at risk. The other thing too, of course, unknown to the board, how could they know? When they produced their first report a few weeks ago, we certainly look around the world and the circumstances with this virus have got worse, not better, in Europe, parts of Asia, and of course in the US. So we believe we have a very strong policy response. This is all about making sure there is one office, one line of accountability, one line of direct operational control, using police, using ADF, using staff that are employed by us or exclusively contracted by us. For instance, there will be no private security whatsoever. That makes it a very different model to, for instance, what's being run in Sydney, but we believe it is the best system for us to put in place. There will be no secondary employment. There will be testing of staff every single day. Their family members will be offered a test every week. We will advance contact trace all of those staff so we know who they live with and what those people do for a living. All of this, I think, is first rate. We've been engaging with the Commonwealth, Jane Holton, who's done a review of hotel quarantine across the country. We've been engaging with the New South Wales Government and New South Wales Police, and we're very grateful for their input. And I believe this is a program that is as safe as it can be. But I am obliged to make the point yet again, no quarantine system, as we've seen, whether it be in Adelaide or in Sydney, or indeed in New Zealand. You can't make it zero risk. There will always be some risk. The key point here is that we've built a system where I think that risk can be managed, and we can have people flying back into Melbourne, and we can build to those numbers, add to those numbers over time, and that this hotel quarantine reset can be part of our COVID-safe summer. I now might ask Minister Neville, who has done an enormous amount of work to get us to this point, to make some comments, and then Ross and Emma may want to add to those comments, and then of course we're happy to take any questions you have on these or any other matters.
Thank you, Premier, and good morning everyone. So this is perhaps the most important thing we've got in the next few months ahead of us before we get a vaccine. This is undoubtedly a much stronger, more robust hotel quarantine program than we had, than in my view we have anywhere else in the country. We have, as a result of the Board of Inquiry, set up a dedicated agency and one minister who are accountable and responsible for this whole program, end to end. Every element of this program will sit within the agency and will sit with me as Minister. That is perhaps one of the big changes that has been undertaken. As the Premier indicated, in developing the reset, not only have we used the Board of Inquiry's recommendations, but we've also tapped into the expertise in New South Wales. We've tapped into the expertise of infection prevention and control experts. We're tapping into Jane Holton. We're trying to make sure that we have stress tested every element of the program, and through that process, since we reset in July, we've made now some more significant changes as well. They include embedding in the program 24 hours, 7 days a week, Victoria Police, about 300 police under the current hotel numbers over a day. About 220 odd ADF a day will be embedded. In addition to that, we will have infection prevention and control embedded in every aspect of the program, whether that's from training, the PPE, the cleaning standards, whether it's having PPE spotters on site, having the healthcare services on site. It is a critical part of the program, which was a recommendation of the Board of Inquiry. We will also have improved experiences for people who are staying there. Although, as you'll see in the release, that people won't be able to do exercise, leave their room for exercise, we will be providing a range of entertainment throughout the day in people's rooms for children and for adults. And also the food quality has been improved. Some of the issues that people raised during the Board of Inquiry in terms of complaints during the first part of this program. We will also have contact mapping. So what this means is that every staff member who works, whether they're the hotel staff or our police officers or our RSOs, our resident support officers that we've specifically employed, every single one of them will be mapped. So who do they live with? Where do they live? Where do the people in their homes work? Where do the kids go to school? And the reason we're doing this is that if a case was to get out, we know immediately, our contact tracing team has immediately at hand the information they need to be able to lock any outbreak down as quickly as possible. We will do daily testing of all staff. This will be a mandatory requirement of the program for anyone working in the program. That will be, over a 5-day working week. That will be 4 saliva or rapid testing, with the aim of being able to get the results before people return to their shift the next day, so that nobody is returning to shift if they have a positive reading, and 1 at the end of each of their working weeks, a full COVID test. We're very confident in the results, the negative results particularly of those rapid testing. They are very accurate in terms of showing negative results. We will provide options for people to stay in the frontline worker hotel as well, where people are concerned for their families or where they may have been tested or may be symptomatic. We'll provide immediate testing for family members who are in any way symptomatic and also offer once-a-week testing. We will also be doing contact tracing will also be embedded in our team. So right from the start, if there are any issues at all, they will be embedded. There will be no delays between a positive case and contact tracing. Each of our staff will be working in work bubbles, so they will have limited contact with limited numbers of staff. So if one of those staff members get any symptoms at all, we're not having to risk other staff getting it or taking offline too many people at a time. Can I be really clear? This is an exclusive staff, whether it's hotel staff, whether it's cleaners, whether it's the RSOs, Victoria Police, these are exclusive staff who work at one site only and only in those jobs. So we've done all we can in terms of both our skilled staff, the skills they have, the training they have, but also the remuneration. So our cleaning staff are full-time, so that there is no temptation, no ability for people to work second jobs. There are daily screening of each of the staff before they start. So this is an extensive reset with extensive risk management, both from the time people arrive at the airport right through to their 14 days in the hotels, but also in the community with our staff, really managing the risks that are associated with the arrivals of people from internationally who are likely, very likely, to be positive. We'll continue our health hotels. They will continue to be operated and managed under our program, but also by Alfred Health, so a very strong health focus there, and 24/7 arrangements with Victoria Police and ADF doing security and floor monitoring there. So this is a very rigorous change. It is a significant change to what we had. This is about making sure we've got the training, the infection control, the exclusivity of our staff, that we will have independent audits regularly undertaken to make sure that this program is the best it can be to reduce the risk. We know Victorians have fought hard to be in this position, and we need to make sure this program lives up to that. That's my commitment, that's the commitment of the Administrative Office, that this will be a program that we can be proud of and one that will reduce risk as far as that is possible. I'll ask Emma to particularly go through a little bit more around some of the training and the audit processes that will be in place.
Thanks, Minister. Good morning. So in terms of the program, we have left no stone unturned in terms of the rigour and the method that we have reset the program. And that includes the moment that people arrive into Melbourne. So we will start assertive screening for all return travellers at the airport. Those who are symptomatic or have temperatures will be taken directly to the health hotel. This is about protecting the rest of the travellers and our staff at the airports. From there, once they arrive at the hotels, we've completely reset all the cleaning and hotel functions. So, as the Minister mentioned, all the contracts have been reset, and we've done that deliberately so we know and we set the standard for all requirements of the hotel, including cleaning, food, waste, linen, and staffing arrangements. All staff are still assertively screened on the way into hotels. That includes temperature testing and the questionnaire about where they've been the last 14 days. Have they come in access or in contact with other high-risk industries? These are all the things that protect the program from the outset. Our staff and the training has been, we've trained, we've retrained, and now, as a number of you are aware, we've been engaging in what we're calling simulations. So the training standards include infection control training, resident experience training, ensuring that our staff can actively interact with residents from the moment they come off the bus. But the infection control training has been face-to-face, which is then supplemented once they arrive at the hotel sites. And that training has been ongoing for the last 2 weeks. The simulations, which have been going for over a week now, will continue this week. And the simulations essentially put all of the procedures into play, and we have staff who are pretending to be returned travellers, and we test those, and we test our procedures, and we test the processes that we've put in place. And I'm really pleased to say that those simulations have been remarkably successful. The only things that we've had to change is some minor processes and positioning of equipment, which is, I think, testament to the reset that we've done over the past 5 months. In terms of the audit and assurance program, we have had both the Chief Health Officer approve our infection control framework and our infection control procedures, which gives us great confidence. And we've had a number of conversations with Jane Holton, and we welcome her review in the next few weeks to really ensure that the program is as safe as it can be and that the program is best practice. For the audit and assurance, we have 3 layers of audit and assurance processes built into the program. That includes the on-site infection control auditors who will be looking at, PPE, cleaning standards, waste standards, to make sure that staff are safe. That includes a second external, but within the AO review, and then we have an external review to ensure that people are safe and that our standards are being met. It also means that we have a process for continuous improvement. So we don't just rest on this being the model today, we will continually look to improve and develop the model as we need to and as the research and the advice from the Chief Health Officer comes through. I think finally, I think the most important thing to note is we are absolutely ready to take return travellers on Monday. Our team have done an incredible job at the reset and they are ready to take return travellers Monday. Thank you.
Thanks, Emma, and good morning, everyone. As has been alluded to by the Premier and Minister, Victoria Police will now take the lead as the lead agency in charge of the security of the program. That has been set up under the auspices of Operation Tide Watch. That means that we will be tracking the program and involved in the program from the point of entry at airside at Melbourne Airport, right through to the ingress and egress at all of the hotels, both health hotels and quarantine hotels. We'll certainly be working in collaboration with the ADF and our people and the RSOs in the quarantine hotels to ensure that security and compliance is maintained throughout the program. Part of that will also be ensuring that agencies are connected in the way they need to be, and that the protocols that have been elicited and placed back into this program are respected from the time we open that program next week to its conclusion, whenever that is, at some point in time next year. So, as I said, we're very happy to be involved from the start point to the end point. We'll be heavily involved with the travellers that come in and able to address any underlying security issues along the way within the program. Thanks very much.
We're happy to take, all of us are happy to take any questions you have. So let me give some general comments, but there are no private security engaged. There will be only Victoria Police performing those roles, as well as ADF, less in terms of security. They'll have other functions of a general nature, I would think. But Victoria Police will be not only leading, but they'll be the exclusive provider of that, if you like, security work. So it's making sure that only those who are allowed in and out are going in and out of the hotel, making sure that the perimeter, any internal boundaries, all of those bubble arrangements are as they should be. This is about making sure that we have the highest degree of formality and therefore the highest degree of certainty. Staff playing key roles, in fact all staff, either employed by the Victorian Government or engaged exclusively for the Victorian Government full-time. No moonlighting, no second jobs, no subcontracting of a subcontract, because there are no subcontracts. It's all direct and obvious and clear. And I'm very grateful to Chief Commissioner Patton for working so closely with us to engage and to make sure that we've got these police available to do this important work. ADF we'll have more to say about the total number and more to say about the sorts of duties. We have to have a further conversation and finalise some of those matters with the federal government and with ADF Command. But that is a massive difference. No private security. Victoria Police doing that important work instead. No, I might let the Minister or whoever wants to deal with that.
So police will be at the airport. ADF will assist with transport. Police will be there when you arrive at the hotel. They will have what is called a site specialist site person who will oversee all the policing and security, work with the site manager. So they will do what they need to do. So they will be there for any incidents that arise, any escorts, if we do have any escorts of people either to the COVID, to the health hotels, or if there are people for mental health reasons who have to exercise. They will do CCTV and floor monitoring through that. On the floors will be a mix of ADF and also the residential support officers, so with the support of Victoria Police. Well, look, let's let the Board of Inquiry go through. I think what we've done is we've acknowledged that there were issues with the program. We've taken on board both the Board of Inquiry, the experts. We've worked with Victoria Police. We've looked at what they've done in every other state, which has used private security. But we now think we have built a model. We've learnt those lessons and we've built a model that's stronger than ever. Well, look, I'll just refer you to my statement to the Board of Inquiry and let's leave it at that. Let's leave it to the Board of Inquiry, other than to say every time I've asked Victoria Police to stand up during this COVID period, they have never said no. Not one bit of pushback. And in fact, you know, my conversations with both Commissioner Patton and also Deputy Commissioner Gunther is that absolutely they have, not only have they said this is the most important job at the moment in Victoria and they are party to it, they are there to do whatever is needed to make sure this program is safe, and Victoria Police are doing exactly that. And
let me just add to the Minister's comments. We can't change what has happened in the past, but we are obliged to learn those lessons, and not just lessons here in Victoria, I might add. We've seen breaches in Adelaide, we've seen breaches in Sydney. We're very grateful for the cooperative relationship we have with the federal government and its agencies, other states and their agencies. The key point here and the most important challenge is to reset this, learning the lessons of the past, and I believe that's exactly what we have done. Beyond that though, we await the final report of the board, and that'll be due, that's due quite soon, and it'll be with us whenever the board is finished that important work. Yes, there will be as is the case in every other state and territory. The final details of that are not yet finalised, but you'll finish up with a resident fee, a fee for the provision of that hotel quarantine. That'll be in line with what's charged in other states. So, for instance, it's about $3,500 per adult in New South Wales, and we, whilst we're always happy to welcome people to Victoria, we don't want any perverse incentives for more people to be coming here because our rates are cheaper. So they'll all be on par with what's charged in other states, and that was a decision that was very well supported around the National Cabinet table.
This was initially the responsibility of...
Let's go Rachel and then we'll go to Simon.
This was initially the responsibility of the Health Department and the Health Minister.
Yes.
The Department of Justice and the Attorney General.
Yes.
Now we're with the Police Minister. I guess it is an infection control issue. Why have you deemed that it's more appropriate for the Police Minister to be in charge of the health control, of an infection control issue?
Well, there's a couple of points. Well, it is about infection prevention and control, but it's also about having certainty about who's going in, who's going out, what each person's doing, every member of the team having clarity about what their role is. And I think when you bring the chain of command and that kind of operational integrity that comes, whether it be from a corrections environment or from a Victoria Police operation, particularly with ADF support, you will finish up with much better outcomes. That's my view. That's why we've reset it that way. I would just say on the issue of different ministers, obviously it needed to be moved when it came to the Department of Justice. It had to be reset, and the coordinating minister, the attorney's done a great job. But it's a fundamentally different program. That's a program for people that are already here and much smaller numbers. It was appropriate to have those arrangements. Now that we are receiving 160 from next Monday, 160 permanent residents and citizens, and that number per day, and that number will grow over time, it's appropriate to have a different, and plus of course the virus status in so many other parts of the world is much worse, much worse. We think the arrangements we've put in place are the best ones, and they will serve us well. Not to eliminate all risk. We're talking about a very human exercise. So you've got to assume that there will be some outbreaks, some very limited number of cases potentially. Making sure we lock those down and respond really quickly, that's the real key, and we believe we've got that work done, that forward planning. But that's a good assumption to work under, just like we assume every single return traveller who comes back will test positive at some point. That's the kind of default setting, and that will serve us well too. On Simon's issue in relation to where police come from, that's ultimately a matter for Victoria Police, but we believe that there is no more important work than making sure that these facilities are secure, these facilities are absolutely compliant with detailed processes and plans to keep the virus inside and not have it seed into the Victorian community. And in the event that it does, as has been the case in Adelaide and in Sydney and in New Zealand, we contact trace rapidly and we stop those chains of transmission as quickly as we can. We believe Victoria Police, with more resources than they've ever had, more recruits than they've ever had, it'll be a challenge for them, as any operation is. But I think they're equal to that task, and people will not see less police out there doing the visible police presence, community policing, all the stuff that's very important part of summer. We have enough resources, and no one who thinks this might be in any way a bit of an invitation to be breaking the law somewhere else, they shouldn't make that judgment. Victoria Police are well resourced and well capable of doing multiple things at the one time. That's exactly why they're such an outstanding police force. Well, why don't we keep going on me for a bit, and then if you want to ask Ross, he can speak in more detail. But I don't think he'll be highlighting for you different areas that.
Are they coming to the stations, or are they coming from the same
Yeah. Yeah, but again, what's really, I'm just appealing to you, all of you. We don't want to be sending a message to anybody that other frontline roles will be poorer because of this, or other frontline roles will be in any way compromised by this. Victoria Police have more resources than they've ever had, and they are able to do multiple things at once. That's what they're particularly good at, and I can't think of a better deployment, a better police operation than playing that exclusive role in terms of securing and maintaining order and structure and formality within those hotel quarantine environments. So, Rich. I'm not certain at this stage. Emma may know. Do you know, Emma?
Waiting on the bed, midweek.
Right. Apparently we will have confirmation of where they're flying from in the middle of the week, and we'll be happy to update you once we get that. They have been picked. I'm happy for Emma to take you through that if you would like to do that. Emma, do you want to do that?
Yeah. So we have secured the hotels and recontracted. In the past month and a half, we have been standing up what we call the built environment, so that all the infection control and prevention strategies, the zoning, the PPE requirements are in place. So that's part of what we've been doing with the simulations, which is testing the built environment to make sure that it keeps people safe and that it makes sense from an infection control and prevention perspective. So there are 11 hotels across Melbourne and the airport regions.
Yes, so the TPA has been part of the journey all through the COVID period, and they are comfortable with where we're landing. No. And look, I haven't had to speak to them personally. The Chief Commissioner and the deputies have spoken to them, and they were very comfortable with the arrangements. There was no conversation with the TPA in March. No. So there is obviously ability for people on compassionate and mental health grounds to be able to seek an exemption through the authorised officers who will be on site. But look, in the end, the decision has been that the risk associated with it is just too high. The more people that move through the hotels and around the hotels, the greater the risk that infection spreads. So we have developed a range of other activities that will be available in people's rooms that, you know, for both children focused as well as for adults, exercise programs, other entertainment programs in order to try and keep people engaged through that process. But we will also have on site now healthcare services that will be on site at each of the hotels. There's also access to mental health services through telehealth. They will be available to everyone as well, and they'll be a really important assessment process to keep people both physically and mentally well during their period there. Sorry, I might get Emma, who I haven't. I'm going down to have a look at some of the hotels shortly to see this in practice. But Emma's been doing that. Do you want to do yours first, Rich, or? Oh, I don't think that's... Look, all of us know that Victorians have done this really tough over the last few months. You know, we have done the hard yards. There is an obligation to try and make sure that we hold on to those hard won outcomes. That means we've got to get this program right. We've got to get the balance right about people returning from countries where we know COVID is well and truly entrenched. So we're just balancing the fact that, you know, the Board of Inquiry told us we had to treat everyone as if they were COVID positive. The program has been stood up in that way, both from an enforcement and compliance end, but also from a health end. Yeah, so they're our health hotels. So we've been operating health hotels since end of July, and they've been largely some people who've come back for work compassion reasons. They are run by Alfred Health, so they still remain under our program and our responsibility. They have 24/7 police, and they've had that since the end of July. They currently do all the floor monitoring and all the entry and perimeter work the Victoria Police do. That will be assisted now by ADF when they start to come in later this week and next week. In addition to that, Alfred Health do all the health services provided there. So they're responsible for all of that, and that's been the case since July. That model's worked well. We've stress tested that as part of this as well. No, so if you are unwell, there is a whole health service that is there available to people. So from, you know, again, to assess, you know, what are their daily needs, do they need to go to hospital, do they need more intensive care? So right through, people who might just be unwell for other reasons will also get the support they need. Yeah, in the case of police, they're a dedicated workforce, so they will have one hotel. They won't be doing any other general duties or other jobs. The only thing that will be required to do is training for their weapon use, but we can do that in groups of police, so that they're not doing that with other general police who are doing their training, and on occasions court duties, but we're working with the courts in relation to minimising that as much as possible. Yeah, so look, we will be doing all we can when we do finish the contact mapping to work with those people who do live with someone from aged care to understand the risk, to offer them opportunities to stay in the frontline accommodation during their shift periods, as well as I know, for example, in any of our new recruitment going forward, we will be looking at ways in which we ensure that we don't have people who are employed who live with someone from aged care. Victoria Police are going through that process now with their workforce, so they're offering anyone who does live with someone in any high-risk industry not to have to take on the role. So, you know, we're doing all we can through the testing, the contact mapping, the contract tracing embedded in the system to be able to reduce any of those risks.
How many hotels and where are
There's 11 hotels all up. I'm not sure we want to hand out all that information about where they are. They're in the CBD areas and airport. Yeah, so at the moment they're all signed by DJCS, the Department of Justice Secretary. They all get moved over to the administrative body as all that's happening right now. Well, look, it doesn't really, because the way we've established is that Emma will become the head of the AO, the State Controller for Hotel Quarantine. Sitting under her will be the Deputy Chief Health Officer for Hotel Quarantine, who's a Deputy State Controller. And that person is a person called Ben Cowie, who is an infectious diseases physician working for Doherty and the Royal Melbourne Hospital. We'll then have Ross as the Deputy State Controller for Enforcement, and we'll have the Deputy State Controller for Operations. So it's still within the framework, but a dedicated agency. So all of the delegations that are required under the emergency management framework have been undertaken. Well, I don't think. Well, let's see what the Board of Inquiry said. I don't think that's what they thought. They thought that those arrangements did stand us in good stead. That's why we're keeping them in that framework.
Can I just add something? So, the structure that the Minister's talking about means it's not one of the current Deputy Chief Health Officers. It's a brand new, specific, dedicated hotel quarantine, infection prevention control, public health expert who leads that team. Then it's not any member of Victoria Police. It is the Deputy Commissioner. Ross will fulfil that role as the controller for all of those elements. And then there'll be a third person, and we'll be able to tell you who that is quite soon. And that'll be somebody who deals with all the very practical issues, logistics, planning, all those sorts of things. And those three will all report up to Emma, who in turn reports to the Minister directly. So it's about putting in place a new body that collects and gathers up all of those who are critical to doing this well, and the only job they have, the only work they have, is doing this job well. And we think that is taking the most relevant of the findings from the first report within a National Cabinet framework, and we're very confident that this will work. Not to deliver a zero risk outcome, I just don't think that's possible, but to mitigate those risks and make sure that if there is, some would say, the inevitable case or outbreak, that we can lock that down really, really quickly. Well, look, we've got to do this right. So I think there'll be opportunities for the CAP to grow, but I'm not in a position today to sign up to a date. We're very grateful to others who have obviously had to process more return travellers because our system has been closed. Our airport essentially has been closed. But I think the most important thing here is to start at that modest level and then build gradually. And when we're in a position to update you on timing and the next kind of increments, if you like, up from the 160, then we absolutely will do that.
Reality that there will be a lot of Victorians who want to be home for Christmas but won't be able to because of that.
No, I don't think that's necessarily the case. I think there will still be other people who will quarantine in other cities. There are also many reasons why someone may not want to come home and may not choose to come home. So whether these airfares are not cheap, there is a queue. We're not letting, that is, as a nation, we're not letting everybody come back on the same day. There's always limits. So I think we're going to try and get as many people back as we possibly can. But I think the vast majority of Victorians, like 99%, I think would say, let's do this right. And that's exactly what we're doing. Chief Health Officer has signed off on all the infection prevention and control planning, all the contact tracing planning, all the public health response. He's been direct and at the centre of this, but it's appropriate. He's got other things to do, so do his deputies currently. So the notion of a brand new, very highly qualified, but brand new Deputy Chief Health Officer who doesn't have to look at restrictions, doesn't have to look at contact tracing beyond that, doesn't have to do all the other coronavirus stuff. He just does those elements that relate to hotel quarantine exclusively. We think that's a really good outcome, and the Chief Health Officer, Professor Sutton, is very supportive of that.
Definitely going to be a he.
Yeah, it is Ben Cowie is the person that's been appointed. He's out of the Weehai, I think. and when we can get you some more details on him, we will. It's all good. I've never walked away from it. It's like I do a runner at halfway through. I've never done that. One at a time, and I'll try as best I can. You can be the judge. Answer all the questions you ask. Yes. Well, it is certainly very big, but it's got a very big reform agenda, and it does sort of fit into two different parts. So you've got family violence, you've got housing, which is a massive program. That in itself is a big enough reform agenda for any department. They are all now in the Department of Families, Fairness and Housing. And if the Youth Minister was here, or any of the other ministers from the other areas I've already listed, they would say that they had a big reform agenda as well. So that makes sense. The other point too is with the Mental Health Royal Commission final report in just a couple of months' time, and the fact that we've had such significant disruption to our health system, for instance, the sheer amount of elective surgery we need to try and get done that couldn't occur safely this year, together with just the size and scale of the impacts and the ongoing nature of this global pandemic, now's the time to split them, but change them as well. It's not just component parts. What you'll notice from the list I read out earlier is that fairness division out of DPC will not be in DPC anymore. It will be over in a brand new department, and that gives DPC, I think, a greater focus on making sure that reform is delivered rather than managing the content of that, if you like.
Is there a concern that similar problems exist in other departments that are affecting similar departments all the way?
No, look, I don't think this should be read, and others may offer some pretty cheap commentary about this, but I wouldn't read this as a criticism that big departments don't work. The big departments who've got an equally big reform agenda, like a massive reform agenda, sometimes you can get too big. So the notion of splitting this, but changing it as well as just, I think, fundamentally recognising that this has been a year like no other, and that the tail of this, if you like, will be long, and therefore giving people the room to be able to focus on the unique challenges that this year has thrown up and will continue to throw up just simply makes sense.
Was your government that amalgamated the two departments in 2015? Was that a mistake?
No, I don't think so. I think that things that happened in 2015 or 2014 or any year perhaps, it's really hard to compare them to what we've learnt this year. This is a year like no other. It's called a 1 in 100 year event for a reason. None of us have lived through this before, and we all pretty well hope not to have to do it again. But now's the time to make those changes. Not just because it's too much to be under one roof. It's also, and perhaps more so, it's about the fact that each of these different divisions, each of these now reconstituted departments, have a massive reform agenda that they want to pursue, and that needs to be done with some urgency. Plus there's repair, and there's recovery, and there's the lasting impacts of a global event like this. Well, people can make their own conclusions. I've announced today a set of departmental arrangements that I think are the best for 2021 and beyond, noting all the lessons, all the learnings, and the unique nature of 2020. I think this is a good fit. If others want to, make judgments about it, well, I'm not going to be a commentator on those matters because they are very much central to the work that the Board of Inquiry is doing. I'll be happy to be drawn on that when the final report comes out, if it's relevant to those issues, but that's not for me to do now. I just think these are the best arrangements. As to whether departmental structures were as they should have been, that will be a matter I think the Board of Inquiry may turn its mind to, and we'll wait and see. I don't want to preempt that, Rich. Despite your constant invitations to do that, I don't think that would be a smart thing. I don't believe so. I think that we have both our government, our partners in the emergency and crisis accommodation sector, as well as, I must say, the Lord Mayor and her team. I think we've all worked very hard, and we've been able to have but a fraction of the people sleeping rough that would normally be doing that. And I think that is, if there's some positives to come out of this year, some of those things have been positive. I'm happy to try and follow up on that for you, but we're about making sure people have got a secure, dependable roof over their head to deal with many challenges they face, whether it be drug and alcohol issues, mental health issues, family violence issues, the list goes on. And one of the things that's come out of this year is we have been, with all of our partners, very successful in that. We want to lock that in and make sure those people have got the security and certainty not to have to go back to being homeless. That's in no one's interest. We all finished up picking up the tab for that. The cost of failure there is huge. No, so they'll all remain, public health will remain part of the health department. And of course, with this being stood up on February 1, that does give us some time, but I don't see this having any impacts on our public health response, whether it be to the global pandemic or all the other work that our public health team does.
Does the Chief Health Officer go somewhere else on the department's org chart?
No, he remains a very important part and someone who leads the public health team. Yes. No, I think that many businesses have used the best of technology in order to be clear about who's in their premise, who they're coming in contact with, and also many venues have used it to place orders and do all sorts of things to minimise the amount of contact. We don't want to upset that. We think that's working very well. What's critical though is there is a product that can be used by anybody who wants to use that product, and all the products, regardless of their origin and the code that sits behind them, can speak to our IT system as seamlessly as possible. That's what the trial was about. That's what today's announcements are about. And I know that Minister Pearson is pleased with where this has got to, and I'll take the opportunity. Your question gives me an opportunity to thank all of those businesses who are doing the right thing. For some, they have been using pen and paper. They'll now be able to, if they choose to move to the Victorian Government product, and to all the others who've been working so hard using different technology that meets their specific needs. Now we can all be confident that those different systems can speak to our central coronavirus IT system in the event that there's a case, an outbreak, and a rapid public health response needed.
Is that capacity to integrate those sorry, can I just finish?
I could try and answer simultaneously. I won't. No, it's all right. I heard both of them, but can you repeat yours, though, Rachel?
Yeah, just on QR codes.
Yes.
Is that integration of QR code systems that private businesses might have been using themselves before the government was set
Yes.
up now integrated properly?
I believe so, yes. I'm happy to have Minister Pearson come back to you on the exact kind of workflow, but the aim, and we've made significant progress, whether we've got to every single product, because it does involve, there's a kind of intermediary product which translates the information, if you like, and makes it compatible with our platform. I'm not sure whether we've done all of that work, but the aim is to have, no matter what the setting, no matter what the QR type product, all of that information, where relevant, can speak to our system and be used by our contact tracers and public health teams, whether it be in the centre of Melbourne, out in the suburban teams, or in the regional teams.
Why we've taken so much longer than other states?
Oh, look, I think we've been very focused on getting this right, and not where you've got systems that are already working. You don't want to upset them. You don't want to knock those off balance. They're working well. There were some gaps. We've got a product that can fill that gap, and beyond that, we've got all that work going on to make sure that, regardless of who the vendor is, regardless of what the code that sits behind the product is, they can all speak to our system. They can all be seen by our system. I just want to again absolutely be really clear with Victorians. This information is only there for 28 days. It gets destroyed afterwards, and it's only used for public health purposes and nothing else. So it's just an easy way that we can be certain about where people were and who they were with, so that if we have to contact trace you, it's just so much easier, and it takes some of the guesswork out of things, and it just means we can have a much more rapid response. On informants, yes. Well, as you know, the Royal Commission will provide its report a little later on today, and I can confirm for you that the Attorney-General will speak to you and provide you with at least an initial response to that. I think you'd appreciate that we'll want to read the report, we'll want to go through all of those details. There'll be some cabinet processes around that, but the Attorney will be out later today to at least give you some initial feedback. Well, there are going to be further restriction announcements subject to how the week unfolds on Sunday, and I'm looking forward to being able to make those. I've got no advice at this stage that the mask rules will change. I'm not saying that won't happen, but I've got no advice to say that it will. That'll be a matter that's worked back and forth this week. We know that it's not pleasant to wear a mask, particularly as the weather is getting warmer. I think the changes we made outside, provided you're not in a group, have been warmly welcomed. They make sense. But we all have to recognise inside 20 times more dangerous than outside. This is an insurance policy. The discomfort of wearing a mask is nothing compared to the discomfort of shutting the place down again. I just don't want to get to that. And for so long as the advice is that they're playing a part in keeping us safe and open, then they will be a feature of our public health response. I'm not sure, but if we can get you any data out of Jobs or another agency, we'll be more than happy to try and do that. Certainly, it was noticeable to me that the traffic was up a bit this morning. But if we've got any other metrics around Google and some of the stuff we have around movement and PT usage, we're more than happy to try and get that to you.
With this restarted program, is that finished with tennis?
Tennis obviously is a quarantine environment as well, and I can confirm for you that I and other senior colleagues spent. We played quite a few sets of tennis in terms of equivalent time over the course of the weekend. This is a massive event. We want it to happen as close to normal timing, and we will have more to say soon. There was many hours over the weekend to try and settle this, and I can't give you a definitive answer today, but we hope to be able to settle these matters and have more to say about it soon. Well, it's the closest to playing tennis I'll get, is talking about it all weekend, which is what we did, because it's a big event and we want it to be done, but it has to be done safely. Only way. Absolutely you can.
Could you sort of give us a sense of where you're drawing these?
Yes, so like any situation where we'd be drawing police for a large event, so they'll come from across the state from the various commands. We've been working closely with the police union in relation to the circumstances for those deployments. Obviously, the most important thing for us is to make sure our BAU continues. So I think the Premier alluded to it before, is that this is not a time to think we won't have more police on the road. We've got a responsibility of providing service to the community. That will continue. But as we do with large sporting events or other activities, we can put a large workforce together pretty quickly, and that's what we're doing.
Any other issues, guys? There's an acting Corrections Commissioner, and that'll be at least till April, and then I think Emma will go back to that role, and we'll have further to say about a new person to run COVID Quarantine Victoria. Emma might be able to provide you with the details of who that person is.
Sure. The acting commissioner is Larissa Strong. And to answer your question about activity and fitness, so that we have a team called Resident Wellbeing, people who have developed a 14-day rolling package for residents. So every day, every hour, there is an activity in which people can engage with, and they include everything from how many steps you can do in your hotel room to yoga, to skipping, to in-chair exercise programs and other support programs and webinars. We also will be making available to return travellers the hiring of exercise equipment. So depending on which hotel you are and the door size, we've got an arrangement where we can actually deliver in a COVID-safe way exercise equipment for residents' use, noting that exercise is such an important element in people's health and well-being.
Given that people won't have access to fresh air breaks, is sport being given to the hotel rooms that you've been taking, so announcing natural light access to being able to open windows, that kind of thing?
Yeah, we've tried our best to ensure that we can accommodate, and pick hotels that are a little bit bigger. We have entered into these contracts, and wherever possible, if we expand the program, that would be absolutely the priority, is to look at alternate styles where they're either opening doors, balconies, which also have other risks. But again, that's absolutely on the agenda for any expansion.
Are there any countries that just won't accept everyone?
That's a matter for the Commonwealth. Yeah. Yep. So there is mental health nurses at every hotel site. and that includes escalation procedures after hours should someone require additional support after hours. But nurses on site 24/7, mental health nurses on site during extended business day hours, and escalation pathways. Yep. So for mandatory quarantine, we have Healthcare Australia, who have been an incredible provider. Healthcare Australia also are looking after the New South Wales Health Service for quarantine.
Any other issues?
The Minister mentioned she was getting a look at the program. Were we able to have a look at one come along? Or is there a pooled opportunity?
I think there will be a pooled opportunity. We've just got a lot of people doing
Good.
simulations, so we'll work out a time.
We don't want to interrupt them, but if we can get you a pooled opportunity, we'll try and do that. That's now a thing. That's now a thing we do, apparently. Organise pooled opportunities. Good. No, there'll be no exercise class.
Yoga.
Well, I'll tell you, seriously, anyway, a lot of meetings on the weekend because it's a big event, and we'll have more to say about it soon. Hopefully we can do it in a safe way. That's what everyone would want, I would think. Just like we're doing the Boxing Day test. Everyone good? No other issues? You sure? Excellent. Thank you. See you later in the week, I think.
I'm going like this. Oh, no,